Hi, I'm Tim Williams, lead trial attorney here at the firm. I'd like to talk about shoulder dislocations and what they may mean to you if it happens to you or a loved one. Now, to visualize the importance of a shoulder dislocation relative to the surrounding tissue, it's probably best we turn to the model. So here we have a left shoulder of this individual, and the nice thing about this model is we can easily rotate it around. So you see there's the back of the shoulder, here's the side, looking at the deltoid, and then this is the front of the shoulder itself. And we remove the tissue, much of the tissue. You can see there's most of the major muscles that are overlying the underlying tissues. So these are the outer muscles. You can see that's the big deltoid muscle, which most people associate with the shoulder muscle there on the side. Let's get through that as well. Then we have some of the smaller muscles that are up underneath and some of the nerves. Let's ditch some of those, including the nerves. And now we have a pretty good visualization of the very deep connective tissues in the shoulder girdle itself. We see ligaments that are attached to the shoulder across the shoulder joint. And let's zoom in here. You can see there's a whole band of ligaments that again attaches from one side of the joint to the other side of the joint. Is to keep stuff out of the joint, is to keep the fluid in there secured, and to allow movement, but also most importantly is to restrict the shoulder from dislocating or hyperextending one way or the other. The problem with a shoulder dislocation is literally this portion of the shoulder, the ball portion, is pulled out and away from the joint portion or the cut portion of the shoulder. So if you think about it, this is the arm bone here, you got your ball at the top of the arm bone. We can just take it away and show you that. So there's the ball portion of the joint. Here's the cut portion of the joint there. And when you pull that shoulder away, when you dislocate it, that's literally what's happening. You're taking the ball and separating it out away from the shoulder. There's two levels of dislocations. There's what's called a separation, which isn't a true dislocation, but it's actually pulled away a little bit, but enough to do some damage, do some soft tissue damage and cause pain and swelling. And you can see there's layers there of connective tissue, and you start pulling this away, is going to add stress to those connective tissue layers, and it could potentially damage those, including partial or total tearing. Again, we add additional layers. You can see there's a lot of additional connective tissue, and so when you start pulling away that ball portion from the socket portion of the joint, again, it stresses those connective tissues. A separation is painful. It tends to get better in a relatively short period of time because, generally speaking, it doesn't cause full tears of the connective tissue. Usually it just causes a symptomatic aggravation. You have some swelling in there, some pain. It tends to go away with proper medication and physical therapy. However, when you have a full dislocation, so not a separation, but a full dislocation, meaning this ball portion of the joint is completely pulled away and out from the socket. Sometimes it's pulled out and away underneath. It's pulled out and away to the back or to the side. It literally falls out from the socket like that. That's where we get bigger problems because you have, again, all that connective tissue. In order for you to get that much movement, there's got to be some give to that tissue. It's either stretched well out of proportion, and generally speaking, it doesn't heal after that, so it's going to be loose, or it's torn partially or totally, which again is going to leave the shoulder joint itself to be loose. Sadly, once you have a full dislocation of your shoulder, those folks are prone to additional dislocations down the line, absent surgery to tighten that shoulder girdle or that shoulder joint back up. So that's the long and the short of a shoulder dislocation.
If you've been injured and need help, Dwyer Williams Cherkoss attorneys will get you the settlement you deserve. Experience gets results.